Good morning, PSWs and friends across Ontario. My name is Miranda Romanowicz. I'm CEO of the Ontario PSW Association. And every Friday, we come to you guys live with PSW Podcast on Facebook, normally, and streamed on TikTok. But unfortunately, today, Facebook is undergoing some changes and we're not able to stream live on Facebook today. So, TikTok, we're here just for you today. Although we will be sharing this podcast next week, obviously on our Facebook platform, so you guys can see what we're talking about. But I am joined yet again with my co-host and COO of both the Ontario PSW Association and PSWA, Ian DaSilva. And we are talking about 16 years of the Ontario PSW Association being in existence, 16 years of advocacy, 16 years of promoting the PSWs, fighting for the PSWs, raising the profile of the personal support worker, and why we exist. Because I think, Ian, there's a lot of those questions,
Yeah,
still out there.
yeah,
Yeah.
you're. And these are we've got and this is not just for OPSWA. I think there's a lot of when you're a lot of new graduates, especially and people who are entering the field, are wondering what is a professional association. That's the question we get too. A lot of people don't know what a professional association is, so I'm just going to explain it quickly, if you don't mind, Miranda.
Yeah, please.
They're,
Yes.
they're essentially, well, all professions in Canada generally are represented by what we call professional associations. These are collections of groups of professionals that get together to form an association like the OPSWA, and their job is to advocate for those members of that profession with government and employers to raise the standards, and establish credibility for the profession. So that's what OPSWA does on a very basic level for personal support workers. So just to clarify, and we're just like other healthcare associations, professional associations, like we are PN, RNAO, the Medical Association for Doctors, the Engineers Association. Everyone has their own association, and PSWs, you have your own as well.
Exactly. So I think a lot of you guys that are watching and probably through COVID is when you really realize the actual power of the association is when there are pandemics or emergency situations and, government has to enact an emergency situation. The association does not go dead. Unlike unions and their collective bargaining agreements and so on and so forth, they can't act on anything at that time. But the associations, well, as we learned, through COVID, get a fire lit underneath our butt, and suddenly we're in charge of everything that pertains to the personal support worker in that moment. So that was an interesting learning curve, even for us at the association, because this association was not started normally. So this association was created 16 years ago, June 10th, 2010, by myself and a handful of other PSWs who unfortunately are no longer with the association because they went off and did other things in their lives, became mothers and got married and so on and so forth. But and unfortunately I could never leave. I just here I am still 16 years later. But anyways, it's been a ride, but we started this association because when I started as a PSW in 2006, and I remember starting in long-term care, there was no support for the PSWs. There was absolutely nothing out there. And we realized really quickly that there was a real need and a desperate need for some form of support for the PSWs. And the government had no interest in doing anything for the PSWs at that time. And so we did it ourselves. And it kind of, to be honest, started kind of like a hobby. I never anticipated that it'd become my full-time job. But here we are 16 years later. And what have we done in 16 years, Ian?
Well, it really, with the last 16 years, it's been a lot of small little battles. Sorry, a lot of huge battles with a lot of small victories, but they accumulate into a better profession overall. So I think in the last 16 years, what we've been encountering is the inclusion. This is a small step, but a necessary step. The inclusion of the PSW's voice in best practice developments. The interprofessional development, interprofessional health teams are seeing more value in the role of PSWs. 20 years ago, it was generally anecdotal that you would hear PSWs being consulted, for example, when doing a care plan. We're seeing,
Yep.
and this is still honored more in the breach than the observance, I admit this, but we're seeing more PSWs being consulted. There's more opportunities for PSWs to actually take an active role in the care plan and development team, in the care plan development rather. Um, this is rather new for the PSW because traditionally the PSW was simply ignored. They were not in the room,
Oh,
even though
yeah.
they were in the room. So
Oh no, we were never in the room.
I know,
Nope.
it's almost like you hear those stories of the Edwardian manners and the servants were never spoken to and never heard of. They're the ones that knew everything that was going on, right? So, but this PSW is not a servant, though. That's this profession. They need to be consulted, and this is the reason why the OPSWA has been really promoting the voice of this profession is because it's vital for patient safety that the personal support worker themselves are consulted because they're the ones doing day-to-day observations of that patient or resident rather. So that's
Yeah,
one
when that's the truth of it. Well, that's one huge
yeah.
element, right? Like I remember my first meeting with government was in 2011, 2012.
Oh, wow.
And I got called, yeah, I know, and ages ago, right? Aging myself here. But I remember going into the meeting with the government and I walked in and I mean, these were lower policy people, right? Of course, we didn't get right to the top right away. That takes time and lots of effort. And I walked in and they were like, "You're a PSW?" And I said, "Is that a bad thing?" They're like, "Oh, no, no, no. We just didn't think you'd look like this." And
Mm-hmm.
I said, "Well, what do you think I'd look like?" Like they
They were
already
expecting
had
you to
an
come into.
idea.
They thought you'd come in scrubs,
Yeah,
not prepared that you'd be dressed in a business suit going to Queens Park.
yeah.
It,
No, they did not
it,
anticipate that at all.
it's an entrenched prejudice with the perception of the PSW that has changed a lot.
That's changed massively.
Yeah, like
Yes, that has changed massively. We are no longer the second thought.
no, not at
Like
all.
a lot of times, PSWs are the majority of times we are being consulted, we are being thought about, we are being, definitely celebrated as a part of the interdisciplinary healthcare team. Now, if I can just get the memos to middle management that
Well,
that is the case.
so let's talk about some of the structural issues that we deal with. So anybody dealing with professional advocacy change, the change comes very slowly. It doesn't
Oh
matter
yeah.
what field you're in. All professions are dealing with trying to advocate to the government to get changes for their specific fields. This is like the constant battle all professions face right across Canada and every country on earth, I imagine, really. Um, but I think what we want to say, I think it's really important to remember also that the association isn't just a small team of people. The association is the collective of all PSWs that are members of it. And this is why it's important for you to join the association and why we really are here. And the association is, as I said, really here to back the PSW and raise that profile. But you're right. I think you caught them off guard in the beginning for sure. But
Oh my gosh, did we ever? And we continue to catch them off guard. And that is one thing that I love so much as an association is being underestimated. I think, we there still is that prejudice, that way of thinking, very much so in the Edwardian Victorian era of healthcare, which we're still in, very much with
very much we are.
very
We are.
much, very,
Yeah.
very much. And they don't anticipate that the PSW Association will have a bite
Right.
but back in the day, Ian, I mean, if you think about it, the nurses have bite. I mean, let's talk about one of my absolute mentors, who's an amazing woman, Doris Greenspun, who's the head of the RNAO. She has completely outdone herself as CEO of the Registered Nursing Association of Ontario. She's a wonderful woman. She's a spitfire. Nobody goes up against Doris because Doris knows what she's talking about and she doesn't let anyone tell her differently. And that's where when we kind of come out, and I was actually compared to Doris, and I took that as a huge compliment because no, you're not going to tell me what a PSW can and cannot do. You're not going to tell me how things play out in the field because number one, I talk to my members every single day. Number two, I was in the trenches
Yeah.
for
Just like
10 years, right? As a PSW.
and so was Dr. Grinspan. She was in that position too.
Yeah.
And I think that's really a testament to the benefit of advocacy, staying on message. And this is why we continue, especially Miranda, why you continue to be so focused on this advocacy element. But Doris also recognized, Dr. Greenspan rather recognized the structural issues that were in place for nurses. These are the same issues that nurses were dealing with. There's an absence of respect. I do not speak for nurses, so I apologize if this comes off
No,
wrong. And
no.
my understanding is that the conflict with nurses was, I think, disregard by higher elements of the profession, doctors, surgeons, and that they weren't being consulted adequately. This is way back in the day, like when I was a child. So, but since that time, you see the power of advocacy. The nurses stuck together as with their association and really made their profile go up. They advanced their career opportunities hugely, but they had to overcome those structural challenges, and this is where the PSW comes in because the PSW is in many ways, well, we are the byproduct of that nursing advocacy.
Mm-hmm.
Needed the PSWs to take some of the different roles that nurses did provide and moved because nurses were moving more to a more clinical diagnostic element and more specialized care.
which which happens. I mean, I have an aunt who was an RNA,
Yep.
and she was there when they changed them over to RPN. And she was grandfathered into that position. And she even said, like, the that is kind of like how healthcare works, because more responsibilities keep going to the up and up and up, right? And they keep going up, and then they keep advancing. The profession keeps advancing, just like the personal support worker. I mean, when the PSW profession was created in 1998, it was an amalgamation of the home support workers 1 and 2 and the healthcare aide, because they were done having all of these different titles. Well, surprise, surprise, how many years later, now we're dealing with, again, more titles underneath the personal support worker. So you have the PSW, which is the be all end all, the front line, the trained individuals that are doing their jobs on the front line. And then you have home support worker, supportive care provider, resident care provider, like you've all these different names that are coming in underneath the PSW because of the need for the employers want to keep costs down. So they don't have to pay someone who's a home support worker or a supportive care aide or, a resident care provider as much as a personal support worker. But then that's when you get into the cross of regulation versus non-regulation, because with the PSWs being regulated as we speak, it's now still it's not mandatory yet, but it's voluntary. And the whole argument of title protection and a standard of a scope of practice, when that comes into play, because I'm going to put that into the universe, when that comes into play, HCAs or HCAs even, HSWs, RCAs, like the supportive care aides, they're going to be up creek without a paddle.
Oh, yeah. Yeah, it is. And this is the problem: is that we've created so many titles to try to dispute what's the word, disperse this population, the population of workforce. That's why wages are low in this workforce. So back to title protection, we get this all the time. Will regulation increase wages? If we have regulation matched to title protection, yes, your wages will go up, because right now, and I've said this 1,000 times, you are competing against people with no education that just say they just say they are a PSW.
Yep.
No one
Because anybody can say they're a PSW.
Anybody can. Especially in the community care, you can just say I'm a PSW, and you can walk in. That's why we need an association that has that advocacy element in place. And these are the structural issues that we're dealing with. Employers are resistant to change this because they're under additional pressures to keep costs manageable. Well, every single manager in any project in the world is under pressure to keep costs manageable. This is the battle.
Yeah.
But at the same point in time, there's a better way of keeping costs down than by diluting the workforce, by creating new titles and making those titles compete against each other to perform the same role. It's silly. It puts the patient at risk. And this is why you need title protection. So PSWs, this is the answer. Your wages are you have to compete for your wages every day against people that have no title protection. That is what we advocate about. That is our primary reason for existing, at least here in OPSWA.
Well, exactly. And not only that, but also to provide the PSW, because let's talk about this then, which is a bit of an iffy topic, but union versus the association.
Yeah, we're not a union.
Yeah, we're not a union. So, what is the difference between us and a union? There's many differences. Ian?
Yeah, unions. Okay, so professional associations represent the profession. We transcend the employment market where the PSW, for example, works. So your membership with an association is professional and it's with you all the time, regardless if you're at work or not. Unions, we play a different role when it comes to employer rights, backing our members. It's more about illegal, making sure ESA is followed. Unions play a very different role. Unions are workplace based. They are responsible for what's the word? Negotiating the collective bargaining agreements for when they expire, and making sure that PSWs and other members of the union, not all of them are for PSWs. This unions represent PSWs, nurses, everyone. They're big collections of groups. That everyone in the working group gets a wage increase. The union's job, therefore, is they have stewards, and then they act to work with their members if there's an employer issue that involves a collective bargaining agreement. So that's what unions do. They have a very important role in Canadian history and continue to do so, but we're not a union. So we don't.
Let me point this out. No, then that's a wonderful explanation. So thank you for that. But let me point this out though. So when you leave work, you're no longer the union's issue.
No.
If it has nothing to do with your job in that workplace that you're underneath the union, there's absolutely nothing that union can do for you if something else happens to you outside of that workplace.
Generally, no.
So that's where the association takes over. So that's where we always say, like, we have a lot of people that ask, if I'm a member of my union, can I be a member of the association? We invite that. We really think that you should. Unions play a very important role in a lot of workplaces across Ontario. However, the association is the one that provides you guys with the insurance elements, with the professional title, because you cannot call yourself a professional unless you are a member of your professional association. That's also another key point. We provide you with yearly criminal record checks. We provide you with continuing education, professional development, right? Insurance options for health and dental and life insurance and all sorts of stuff like that. And of course, access to our discount partners, which many of you guys know is like Mark's Work Warehouse, CAA, Rogers Wireless, and the list goes on and on. And we do all these things to help make your life more affordable, but also to give you that community. That's what the association's about, is to give you that community. Like, I go here on TikTok 2-3 times a week, and I talk to PSWs on TikTok. There's not a lot of associations that CEOs do that, but I do that because I enjoy it. And I enjoy connecting with our PSWs because there's that need for that the questions to be answered and to see what's going on in the field. It's important to stay up to date on those things.
Absolutely. No, and that's exactly the role that we need to play as an association. But don't forget the other part, not the other thing that we do as an association. So one other element is title protection. And the reason this is important is because there shouldn't be anyone doing a PSW job that's not a PSW. The basic care in Ontario should be performed by a PSW and only a PSW that are delegated by families or nurses who are delegated by doctors. That's how it's got to work. Right now, what we have is this too many titles competing for care. And again, that's why the association really needs support. But you're right, the benefits, the more members we have, the more benefits we get for everyone else that's a part of it. The other thing I wanted to jump in about was professional development. The other role the association is starting to play a bigger role in, aside from best practices, which we'll have to do another podcast about in the future about some of those developments. Professional development. We don't want everyone to become a nurse. We are, of course, encouraging. I mean, we're supportive of PSWs that want to go into nursing. Absolutely. But as the PSW Professional Association, Miranda, tell us about some of the things we're doing.
So I'm not against begging them to stay as PSWs. I'm just being honest. We really saw it through COVID, and I think it had a huge impact on Ian and I, where we didn't have enough PSWs when a pandemic hit. And when I tell you guys, and many of you know, it was hell. So we don't ever want to go through that again. We're not against you guys, obviously, going into nursing, whatever you guys want to do, but do realize that as a personal support worker, you can specialize and you can do those things and stay as a PSW. For instance, I'm a mental health PSW. I did a lot of extra training after I did my PSW course at Mohawk College way back in the day, and I became a mental health PSW, and I worked on lockdown floors. I worked with in home care with mental health cases, and I had a great time. I had a riot, and I was paid more than my other fellow PSWs who didn't have the extra training or specialization. So, you know, we have through the PDC, which we call it the Professional Development Center, that's OPSWAs, we do have training in mental health. We have training in introduction to autism. We also have a specialization in autism as well. And we have de-escalation, which is like, you know, de-escalation to how to calm a situation down, how to deal with, you know, controversial situations with a resident, you know, what to do, what not to do, sort of things as well. We have practice in professionalism, which is also really great to learn because it talks about teamwork and it talks about, you know, building yourself up as a professional, because guys, we're going in that direction. We have in a long time. We are going to be expected to be firmly professional across the board. And so you guys, a lot of us need to have that extra kind of, oh yeah, I remember now. Okay, this is how I do this, is how I do that kind of thing, right? And we just announced a new course, which is palliative care from a PSW perspective. So we have some really great courses, more to come, but we do have some great courses.
And we wanted to do, and we did, we're endorsing the Pallium program as well, which is
the Pallium, the LEAP program with Pallium, absolutely fantastic program as well. Pallium Canada is the palliative care provider for education across Canada. They're fantastic. We were just in Parliament Hill with them 2 weeks ago to do a press conference about this training for PSWs. So, take an opportunity to check them out as well. They're a really great place to be. And of course, our partners at the Regional Learning Center also have some great training through their partner with Nucleus Independent Living. They're a part of them, and they have some great courses there as well. A lot of this done online. So there's no reason not to enhance your training as a personal support worker.
No, and there's
All
opportunity.
very affordable. All very affordable.
And you can even work on we have a new locator map that we are very happy about. And it's, if you're interested in working for yourself, please visit the map. And if you're looking for PSWs.
I'm going to talk about that for a second because that's huge. So we have a private practice PSW directory. It's a locator map on our website where we put up a lot of our private practice PSWs that work for themselves. And many of them are having huge success because members of the public are coming and they're finding private practice PSWs who they're hiring directly. I am so thrilled about that.
Yeah,
I really think that's the future of healthcare and
well,
home care, at least.
Well, at least it gives people some choice when dealing with it. And right now, there's so many different options when you're dealing with home care. So we're encouraging anyone that's looking for. It's a small list. We're just getting started, so more people are being added regularly. But have a look at it. There is generally PSW somewhere in your area. That's what it's there for. These are certified, insured individuals. Follow a code of practice. Have clearance checks. These are the highest standards you are going to find in finding a PSW anywhere in Ontario. These are even
that's any OPSWA PSW.
They exceed current government standards. So
all OPSWA PSWs.
All OPSWA PSWs. If you're members of our association, you are a step above the government standards. And if you're part of us and the HESCOPORA, you are future proof. You are locked in and you're good to go.
Good to go. Good to go. Well, Ian, it's getting really hot in my office. So
yeah, it's hot outside. I can tell. Yeah.
I'm starting to get a bit sweaty here, but anyways, a big apologies to our Facebook followers that we were not able to go live on Facebook today. Thank you, Meta. Appreciate that. But we'll be putting this out onto Facebook once it's recorded, so that you'll be able to see it there. Thank you to our TikTok group that has been watching us talk about 16 years of OPSWA and why we exist. It's been a really great conversation. Next Friday, we actually have some really interesting guests that are going to be coming on to PSW Podcast. We're having the Nurse Practitioner Association of Ontario is going to be joining us. Their CEO, Michelle Gray. She's going to be here, I think, with one of her colleagues. Sorry, I don't remember her name, but we're excited to have the NPAO on here. We are definitely partners and friends in the healthcare space, so it'll be interesting to hear about the nurse practitioners.
Speaking of good advocates, well done, Michelle. Yes. Advocate there, and yeah, a testament, example of what the power of advocacy and what the power of professional communities can do. So hats off to the NPAO and well done. We'll look forward to it.
Absolutely. So remember to come back next Friday and join us live at 11 a.m. for PSW Podcast. Next week, we'll be with the Nurse Practitioners Association of Ontario. So that should be a good conversation. Remember to stay hydrated and cool this weekend. It's going to be a hot one, guys. So make sure you take care of yourself, take care of your residents and your clients and your patients, and don't overdo yourself. Remember that if you're not a member yet, head over to our main profile here on TikTok or on Facebook, click the link in our bio, and it's all self-explanatory from there. If you're not an OPSWA member, you're not protected, so make sure you get on that. Thanks very much, everyone, for joining us yet again for another PSW podcast. And with that, we're going to say OPSWA out.